Today, we will be sharing healthcare accessibility barriers among persons with disabilities during the COVID-19 pandemic. Hi, my name is Lydia, and I work as the Community Relations Specialist for the Texas Epidemic Public Health Institute in the Vulnerable Populations Preparedness Program. In the past, I have assisted in developing health educational materials and campaigns targeting at-risk populations about COVID-19 vaccination and hepatitis B and C. As a CSW, I have spearheaded community outreach and engagement activities to promote health awareness and service access. As a contact tracer and case manager, I assisted in data collection, analysis, and reporting for public health surveillance programs related to COVID-19.
Hello, my name is Kristen Campbell. I'm a current program coordinator for the Epidemic Public Health Institute under the Vulnerable Populations Preparedness Program at UT Health School of Public Health. I've experienced developing and assisting in COVID-19 vaccination promotion by creating educational content, conducting community outreach, and contact tracing. I have additional experience with data collection, analysis, and reporting related to various public health topics, including suicide prevention, HIV, and women's health.
Our mission at TEFI is to keep Texans safe and the economy strong by strengthening the capacity and resilience of Texas communities to respond to future infectious disease outbreaks. We believe that if we support the public health workforce, we can prepare Texans for public health threats, related infectious diseases, and eventually promote a strong economy resilient to infectious diseases.
Disability, as described by the World Health Organization, is an interaction between a person's functional impairments and the physical and social environment. The term persons with disabilities represents PWDs represents those who experience visible or non-visible disabilities. In the US, functional impairments are commonly categorized into 6 types: mobility, cognition, blindness, deafness, independent living, and self-care.
1 in 4 Texans live with at least one disability. PWDs in Texas are more likely to experience chronic health issues, such as heart disease, depression, diabetes, and socioeconomic disparities, such as poverty, unemployment, and a lack of high school diploma. And 1 in 5 Texans with a disability live in poverty and lack access to adequate health care.
On March 13, 2020, Texas declared a public health emergency in the face of the COVID-19 pandemic. The pandemic exacerbated already existing health disparities of PWDs and put them at increased marginalization in healthcare during this public health crisis. Emerging evidence suggests that the COVID-19 pandemic impacted PWDs with higher morbidity and mortality rates compared to non-disabled populations.
The primary aim of the current study was to broadly understand the experiences of people with disabilities, PWDs, in Texas, and their access to vaccination. Our secondary goal was identifying best practices in disseminating critical public health information and resources to this vulnerable population.
Participants were selected based on their close ties with PWDs and were selected through a rapid assessment approach. Semi-structured interviews lasting 1 hour were conducted via virtual meeting platforms to gain insight into healthcare access during the pandemic. And post-interview analyses involved identifying key themes from transcribed content. Here's a table of our interviewees with their various experiences working with people with disabilities at different organizational levels.
The results from our study indicated that PWDs experienced additional burdens in obtaining equitable healthcare treatment and information during the COVID-19 pandemic. 3 general themes were identified through the analysis of the qualitative interviews. Environmental barriers, where the participants reported significant obstacles in obtaining accurate and timely public health information and services, which were crucial during the pandemic. Disparities in healthcare access, where the interviewees revealed noticeable gaps in healthcare stemming from inaccessibility issues, further disadvantaging persons with disability. And potential interventions, where participants propose solutions to better cater to the needs of persons with disabilities during disease outbreaks, while emphasizing the importance of inclusive practices.
We define environmental barriers based on the definition by the World Health Organization as factors in a person's environment that through their absence or presence limits functioning and creates disability. The highlighted barriers included a physical environment that is not accessible, lack of relevant assistive technology, assistive, adaptive, and rehabilitative devices, negative attitudes of people towards disability, services, systems, and policies that are either non-existent or that hinder the involvement of all people with a health condition in all areas of life.
We found subthemes of language, information, access, and transportation being discussed repeatedly during the interviews. The key takeaways from these themes were that barriers are often intertwined with not being able to communicate in a known or established sign language. Communication in their non primary language led to less than ideal communication results.
Access and transportation barriers were concerns brought up by participants, which are highlighted by the following quotes. Our cases were those that didn't have transportation or were essentially homebound. They couldn't get to vaccinations. What people go through with the pandemic was just another version of what they go through every day.
Participants highlighted information barriers and its impact on PWDs. It was important to note when a participant brought the need for effective communication and implications of the lack of it, such as sit down for 15 minutes to see how you feel. In San Antonio alone, 3 people who are deaf died from complications because no one could say, you need to sit and wait.
Language barriers was a prominent subtheme identified within environmental barriers. One participant highlighted that sign language has no roots in English. It has no writing system. So here you are, and you're going to tell all this population to go to the website and register. That would be like me telling you it's in Swahili, go register, highlighting the difficulties someone with a language barrier, specifically those who are deaf, may have in accessing information or signing up for information, which is further highlighted by the participant saying, if I'm deaf and do not read and write your language, and please don't say I can't read and write. That is a serious insult. If to find that information isn't clearly right there when I get there, I can't navigate your website to get to it.
We defined the disparities in healthcare and inaccessibility gaps as per the Center for Disease Control in our codebook as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations.
Subthemes we found were disparities based on disability type, lack of social support, and lack of demographic information. Key takeaways of this theme was the importance of raising awareness for developing mitigation strategies to support PWDs in healthcare settings.
Inaccessibility gap based on disability type was discussed during the interviews, highlighting the need to be aware of types of disability. Participants shared, I think physical accessibility is the first thing we think about, what we look at. But then, but then you need to move on, right? To what are other disabilities and what do we need to be aware?
Within the subtheme of lack of social support, one participant, when talking about parents of deaf individuals, said, and because their parents were like they had a broken child and they just didn't want them. So even today, did you know that the national stats say that only 9 out of 10 parents with deaf or deafblind kids ever learn to sign?
Participants also discussed how disparities in healthcare were impacted because of the lack of demographic information. As a participant shared, Even if you look at vaccine information data, it's there. There's not disability specific stuff. It's race, gender, but in order to truly check disparities, you've got to have the data to start with, right? So that's one of the things we are trying to have.
During the interviews, respondents emphasized and identified potential interventions to improve response for PWDs during emergency situations. This included the subthemes of disability inclusion, educating communities, educating healthcare providers, addressing misinformation, improving access and accessibility, and implementing targeted programs for PWDs. The key takeaways of this theme include the burden of PWDs for compensating for the lack of knowledge of disability, training providers and community members, the unprepared healthcare system to address PWD needs, improving accessibility via educational workshops, and the creation of inclusive flyers and websites as one of the many ways to improve PWD's accessibility.
Our participants shared that making information accessible is only limited by the intent. There's nothing out there that you do that we can't make it accessible. Another participant working towards training accessibility to healthcare providers shared everything in ASL in simple language and information that was designed with people with disabilities in mind from social stories is included in our KIT communication boards, which highlights that it's totally possible to make information accessible. Our participant also highlighted the differences in literacy levels, especially for PWDs. Deaf do not feel their literacy challenged because their language isn't. So a quick way to insult them is to say, oh, you can't write. But all the information that you want to share, making it accessible, we actually reach out to the community and get them to come. Another participant brought to light the need for understanding various disabilities and issues faced by this vulnerable population. It gives you tips and tools on working with what the disability is. What are the access issues that somebody with this type of disability might have at your pharmacy or clinic?
In addition to disability inclusion, it is also important to educate community members. As one participant stated, we have to educate the people providing the resources if we're going to create safe and trusted spaces that people with disabilities are actually willing to go to and participate.
Another potential intervention discussed by the participants was to address misinformation. If you don't know what information is out there and in an accessible format, no matter how ridiculous it is, they, PWDs, share the same misinformation if they don't have it. Like someone told them the president on TV said that COVID is finished, done.
On a way to improve accessibility, a participant said, yeah, but we do want to be a part of this, problem solving, solution. And it's about bringing the right people to the table. I don't have all the answers, but I can identify when we have a gap or bring in the right people. Like I learned so much from the disability community.
Participants also emphasized the need for targeted programs, practices for people with disabilities. One of them commenting that we needed an emergency preparedness sheet for individuals and family, right? That was inclusive of the disability community needs. Another participant shared, did you know we have accessibility alerts here? That if there's a threat of ice flooding, it goes out, it's voiced in some sign language.
In conclusion, our report has shown that PWDs experience additional burdens during the pandemic. The rapid assessment revealed that persons with disabilities faced extra challenges in obtaining adequate healthcare treatment and information during the pandemic. PWDs also experience exacerbated disparities. Many educational resources on vaccines and treatments were found to be largely inaccessible, worsening the health disparities experienced by this vulnerable group.
The findings suggest that including PWDs in discussions on effectively meeting their needs, along with educating healthcare providers on effective communication methods for PWDs and providing them with communication resources, are fundamental steps that public health professionals must consider in preparing for future outbreaks and pandemics.
Thank you for your interest in improving healthcare accessibility among persons with disabilities. If you have any questions, please contact community@tefi.texas.gov. Or to learn more about TEFI, including additional learning opportunities, please visit tefi.texas.gov. Thank you.